Hello, KJR readers. It's my great honor to introduce our research here. My name is Yu-Sen Huang, a radiologist from National Taiwan University Hospital. The title of our research is Treatment Response Evaluation by Computed Tomography Pulmonary Vasculature Analysis in patients with chronic thromboembolic pulmonary hypertension. Introduction. Chronic thromboembolic pulmonary hypertension, CTEPH, is a rare disease characterized by unresolved pulmonary embolisms and pulmonary artery obstruction, resulting in increased pulmonary vascular resistance (PVR) and progressive right ventricular dysfunction. Resigrad, a soluble guanylate cyclase stimulator, is indicated for the treatment of CTEPH after surgical treatment or inoperable CTEPH. The current diagnostic methods and treatment response evaluation of CTEPH require invasive right heart catheterization to assess hemodynamic parameters. The aim of this study is to quantitatively assess pulmonary vasculature using non-contrast CT pre and post-treatment and correlate the image parameter with right heart catheter hemodynamic and clinical parameters to evaluate the implication of CT parameters regarding disease severity and treatment efficacy. Patients with suspected CTEPH underwent both contrast-enhanced and non-contrast CT simultaneously in our hospital to confirm the thromboembolic basis of pulmonary hypertension. Our study inclusion criteria include confirmed diagnosis of CTEPH by multidisciplinary discussion, inoperable for pulmonary endarterectomy. The patients received Resigrad for at least 16 weeks with or without balloon pulmonary artery angioplasty and underwent both right heart catheter and CT pulmonary vasculature analysis pre and post-treatment. Only a few cases were excluded in this flowchart. The right heart catheter parameters include mean pulmonary artery pressure, pulmonary vasculature resistance, and cardiac intact. The CT-based pulmonary vasculature parameters include subpleural vessel numbers, densities, and the BV5, that is, blood volume in small vessels with cross-sectional area smaller than 5 mm square. A total of 30 patients have the complete data, and the correlation of CT-based and right heart catheter-based hemodynamic parameters were analyzed. In addition, clinical parameters such as WHO functional class 6-minute walk distance were also analyzed. 3D pulmonary vasculature reconstruction shows vascular pruning before the treatment. That is the reduction in the volume of peripheral small vessels. And after 12 months Resigrad treatment, the peripheral perfusion increased and the vascular pruning improved. And the patient's mean pulmonary artery pressure decreased from 44 mm mercury to 34. This is the demographic data and measurements of the 30 persons, including the pre-treatment, post-treatment, and percentage change about clinical CT measurements and right heart catheter hemodynamic parameters. Scatter plot demonstrating correlations between CT pulmonary vasculature and right heart hemodynamic parameters. Mean pulmonary artery pressure, pulmonary vascular resistance is significantly negatively correlated with CT measurements, number, density, and BV5 crossed total blood volume, whereas cardio index is significantly positively correlated with CT measurements. Scatter plots demonstrating correlations between percentage changes, pre to post-treatment, in the CT and hemodynamic parameters. The percentage reduction in mean pulmonary artery pressure and pulmonary vascular resistance is significantly correlated with the percentage increment in the CT measures. The percentage increment in the cardio index is significantly correlated with the percentage increment. These are the comparisons between the radiographic pulmonary vasculatures and the clinical parameters. The WHO functional classes are inversely associated with radiographic pulmonary vasculatures, whereas 6-minute walking distance is positively associated with radiographic pulmonary vasculatures. Conclusion: CT-based pulmonary vasculature measures provide a quantitative assessment of pulmonary vasculature changes in response to medical treatment and correlate with invasive pulmonary hemodynamic and clinical parameters in patients with CTEPH. They may provide information for the evaluation of disease severity and treatment efficacy. Overall, non-contrast CT has the advantage of non-invasiveness and avoidance of contrast media allergy and nephropathy, benefiting patients with impaired renal function or history of allergy. Thanks for your listening.